Okay, I think we'll go ahead and get started. If anybody else comes on, that's fine. So first of all, hello, welcome to our presentation on on-site services. Again, if you can mute yourself, if you have a question or comment, which we encourage, go ahead and just unmute or type something in the box. And we have that available here so we can see any message that you have. So I introduced myself first of all. I'm Greg Monson. And also in the studio today is Larry Radigan, and we're going to talk about on-site services. And Deb Healy is operating our controls today, so to make sure that we're hopefully working. So on-site services, this is another avenue or area that we want to work with employers on, and to help them manage their musculoskeletal problems or disorders, prevent them and manage them. So we're going to spend some time today talking about the services that we can provide. And it's not going to be an in-depth in terms of how to do all of this. It's just more of an overview, exposure to the services that we are able to provide to work with employers and their employees to prevent and manage musculoskeletal disorders. And as we talked about before, it's a good opportunity in all of our regions to expand, work with businesses more, because it's well within our wheelhouse in terms of what we can help them with. And so kind of the format today is that we have an overview. Larry's going to talk a lot about what he's been doing at some of the locations. So it will be a lot of examples of things that he is doing on site right now. And between the two of us over the last many years, we've had the opportunity of going on site to multiple companies and providing to some degree these the services. And we've had a more organized effort in the last few months with Ken taking this over, expanding on what he's been doing in wellness and add some organizational structure to it. We realize that we're not the only ones that have had experience with this, so if you have any comments, questions, please throw those out there. We can all benefit from the exposure and experience that everybody has had. So please throw anything out there you feel is relevant. So we're going to start out with, you've seen this pie diagram that Ken put together outlining the services that we are able to provide and want to expand upon. So some time ago we had the Work Comp 101 presentation to kind of introduce the concept of how to manage work comp patients in our clinic. So the injured workers on the upper right hand corner there. So on the left hand side is hiring healthy employees, post-offer employment tests that we talked with and had training a month or so ago, work steps protocol. And then what we're talking about now is in that category to keep employees healthy. And certainly Ken's corporate wellness program is very much a part of that, and something we're looking at to expand upon, build upon, because those employers that are utilizing the wellness program would make sense to me that they're interested in some of these other services. And that's where on-site services as a portion of that keeping healthy employees healthy. But you'll see also as we talk about this that on-site services are not just keeping them healthy, but you're going to run into where they're injured workers. So the on-site services really crosses over into the injured worker segment of that pie as well. Yeah. So again, just if everybody can make sure that they're muting their microphone, we're getting a little bit of noise someplace. So if you could just check that, thank you. So the on-site services, what is it we're talking about? To give a definition of it, it's as the name would imply, is it's some healthcare providers, one of our providers going to the work site, on the workplace, and with the goal of reducing the musculoskeletal disorders. And it's a combination of preventative type of services as well as intervention. Ideally, we want to prevent those problems, but there's on-site services that involve intervention or treating someone after they've had a complaint somewhere along that spectrum from early intervention to chronic. Our goal really is to be a consultant for that employer and working with them to provide solutions, to prevent, manage their musculoskeletal problems, to help their employees, help their business operations. We want to be, the people that they call. Call Rock Valley first is really what we're trying to accomplish here, so that they consider us first of all. So on-site services, as I indicated, can be preventative in nature. And we'll talk about some of the processes that would be involved with that, like ergonomic assessments, for example, but also there's some degree of intervention, from early intervening with an employee that has a problem, and all of the processes that go into place to mitigate that problem so it doesn't get to be a big issue. So the current, first of all, going through a list of some of the services that we could provide. And what I'll do here is just go through a list of them with a brief description, and then as we go through them, we're going to look at each one of them a little bit more in depth. And Larry's going to expand on each one of these by talking about what he's doing at some of the locations that he's currently on site, which I think will be helpful in explaining the process a little bit more. Because as you'll see, if you don't know already, is that there may be situations where you go on site with the intent of providing one service, but it kind of expands and they all somewhat meld together. So it's sometimes difficult to delineate specifically each service out. It comes down to what is it the employer particularly wants from us. So early intervention, as the name would imply, would be a process where someone has a problem, they come in with a sore shoulder, whether it would be from a job injury or a non-work related injury, what are the processes, how does the company handle that. We can have an integral role in managing those so that they don't become a more bigger problem, resulting in lost days and more significant disability from that problem. Then you get into a host of a process that has multiple names. And so I've got, I think, three different names listed here, and this is just different variations of the same thing. You may hear the term physical demand assessment, essential job analysis, job function description. Some people just call it job analysis. But the bottom line is with this, you're just looking at the physical requirements of a specific job. You're going through a process of recording and measuring. So it's a quantification of the physical demands of the job. Ergonomic risk analysis is another service that you're looking at a particular job and identifying what are the risks associated with that job that may increase the likelihood of a musculoskeletal problem. And kind of getting into that same area then is not only looking at how the workstation is set up, but how that person performs the job and interacts with the work environment. So that's a service. Job coaching is, as the name would imply, you're working with the employee individually at their workstation, coaching them, instructing them, helping them do the job better. Because even though ergonomically the job is structured properly, the person may not be utilizing the tools and the setup that they have. They may not be aware of how they're putting themselves at risk or causing potential problems that contributes to their complaint. And very similar to that is employee education. There's education obviously involved with job coaching, but that also might imply where the employer calls and said, hey, could somebody come out and give me a 30-minute presentation on how to protect your back or ergonomics or lifting techniques. So they're intermixed, but they may be separate. So basically, it could be in a group session situation as opposed to a one-on-one. And then Employers oftentimes will want a stretching program, or what's called a warm-up program, as part of their overall prevention strategy. So that's something that we can provide. So those are the list of services that we're capable of providing. And obviously, when we want to get to the point where we can provide these in all the regions. And so we'll elaborate a little bit more on each one of these. Oh, the last one is treatment. We do have situations right now where we're providing treatment on site. In some situations, it may be for employees that have been injured on the job. Other situations in which they provide non-work related injuries. I think Jason at Lyondell is still doing that, for example. So it is possible that we actually have a clinic, small clinic on site. Although, as you can imagine, it's typically the larger employers that have capacity, they have the volume, potentially the space to do something like that. So it's not a high prevalence, but we do have situations where that exists. So just to give you an idea of some of the employers that we're currently working with, employers in different areas that we have contracts with to some extent to provide services for, mostly on site. So for example, Case New Holland in Burlington and soon in the Peoria area, we have therapists on site doing treatment, but also Larry's been going to Burlington quite frequently and doing a lot of these job analysis, job assessments, job coaching, and he'll expand upon some of those things that he's doing there. HON or HNI in Muscatine. We've been doing more with them recently. Again, Larry's been doing a lot with them in terms of going on site, but also training their supervisors or safety managers to do some of the ergonomic risk analysis and job demands assessments. Carver Pump in Muscatine, we just recently started working with them. It's not operational yet, but it's in the process. Again, going on site, working with their employees, and Larry will discuss that. Lyondell in Clinton, Jason Tampier is providing some services on site there. We also do post-offer employment testing for Lyondell. So again, in that pre-hire phase, hiring healthy workers, and we do a fair amount of those every year. And then the city of Davenport, not so much on site anymore, but we have a contract with them to provide treatment in our clinic, which sometimes does allow us to go out and look at jobs and do some of the on-site services that we're talking about. So just to give you an idea of some of the current employees, and these are, I think, good models for us to carry forward into other areas. These employers that have shown that they're interested in prevention and intervening early because they recognize the benefit from their standpoint in reducing their costs, reducing their lost days, which is very important to them, as well as helping their employees. So these are great models, situations that I think we can build upon, and other companies utilize that and
my counselor would not be the host.
Continue. So obviously we want to go to other areas, and that's why you're all listening to this. And so we need, quite obviously, to train other people to do this. And take a minute about kind of how we're going to approach it in terms of training other people to provide these services. So kind of the process, step one is what you're doing right now. Listening to today's presentation as well as next week, we'll cover the basics, outlining the things that we want to train on. That the problem with the
I thought I sent you that email of this.
Oh. Hey, Mike.
Yes,
Could you mute your computer there?
I had earlier, sorry.
Oh, that's okay. Is when it comes to some of the more technical aspects of this, for example, the job analysis, the ergonomic assessments, we feel it's better to actually kind of a one-on-one training. It's very difficult in this type of situation to do that. So the thought was that listening to this, getting the background of it, and then utilizing Larry, I call him Coach Larry, that when it has been identified in your area, there is an employer that needs these services, then either you or your whoever you designate in your area to be the person that's going to do these, Larry would come out and spend some one-on-one time in talking about the technical aspects of it. So the ergonomic assessments, how to do that, what form to utilize, how to record it. Same thing with the job demands assessment. So the forms that we have will be specific to those two. Depending on the employer, they may have their own form or process to fill out. So there would be a process whereby once that's identified, person's identified, he would come out and spend some quality time and going on site to help mentor that person through the process, reviewing reports afterward until they feel comfortable doing that. So meeting the employer through this process is really key. Obviously, who are the people to contact? Who are the ones on site that are being dealt with? But also to really understand what the employer's needs are. And this sounds easy. Sometimes it can be difficult because when I mentioned before, the names that are associated with some of these services, getting the physical requirements of the job could have 3 or 4 different names. Sometimes they'll say, well, I need an ergonomic assessment, when what they really mean is they want to have the physical requirements of the job. So you really have to understand what their goals are, what do they really want to accomplish, and they may use names that mean something different to us. So that can be a challenge, and it's a whole communication process. Touring the facility, becoming familiar with the jobs, the people, the contacts, and making yourself visible is all part of that process. And again, once that particular situation identified, Larry can help that person get through that. And then, of course, developing the program, implementing it, and then the follow-up, okay, so that we have a good, consistent product and people are confident in doing what they're being asked to do. Just as when we talked before about in the Work Comp 101 a couple months ago, or whenever we did that, there are stakeholders in any of these situations, and just very similarly on site, there are certain stakeholders that you have to be aware of, and what their motivations, what their emphasis are. The employee is probably the biggest stakeholder. They're the ones involved with it, doing the job. They have the complaint, and having familiarity with what their goals are, what their issues are is obvious. And every employer is going to be different from the standpoint of what people are in what roles. Bigger companies are going to have more positions. Smaller companies, one person may be serving multiple roles. But knowing who the supervisors are, the managers are, recognizing oftentimes that production is their main purpose. That's why they're there. They're graded on their production, which may be create conflict with the employees' problems, but being aware of that dynamic. Again, depending on the size of the company, they may have safety managers. That same person may be the risk manager, it may be somebody different, industrial hygienists. They may have an ergonomic team. Again, depending on the size. Okay, we would like to have interaction with all of those people. The safety and risk managers obviously are more concerned about a lot of these issues in terms of risk and preventing injuries is perhaps more than the supervisor will. If they have an ergonomic team, we would like to be part of that team. We feel we have something to contribute to that. They may have an occupational health department. They might have a nurse in there, a physician. Oftentimes, they'll be a part-time physician that come in and out, physician's assistant, some healthcare provider that they might have on site, and knowing that person's role, how they fit into it, how we interact with them. But again, Your bigger companies are going to have that, smaller obviously will not. But if they don't have that, it's helpful to know what is their process of handling injuries. If it's an outside doctor, outside occupational health facility, who that doctor is important to know what their process is in terms of referring out. And of course, the human resources, they're going to be very much involved in that and knowing who those people are as well. They may have a work comp case manager, knowing who that person is if it's a work comp injury, and being able to interact and knowing who that person is and what their role is. So being aware of those stakeholders once you get on site is a good idea. Okay, so that's just a little introduction to this whole process. Any comments, questions, insights from anybody would certainly be interested in if anybody has any comments.
One of the things about the training process of it is, I've been fortunate to have 26 years of mentorship with Greg, and so a lot of this stuff is you're going to get better, and the more you see, the more you're on. So some of this can be overwhelming a little bit, and we're giving basics, but we learn, you really learn as time goes on what the need is, and there's a lot of common terminologies and what company wants, and so. We're going to recognize there's a lot of different skill sets that people have that are learning to do on-site services. And we're going to take that in consideration when we're training. We're going to set up some type of training schedule. And with technology, we can do a lot by phone and emails and meetings. But, I think there's certainly going to be a component on site. And so we're going to roll that out in a training mechanism or a way that is hopefully not too overwhelming. But moves it along and so we can be productive on site.
So going a little bit more in depth as to each one of those services that we outlined earlier, let's talk about the early intervention aspect of it, as to what that entails, what that means. So I'll give a little bit of background, and then Larry will kind of describe how he would handle that in situations at the employers on site that he's been doing recently. So as the name would intuitively imply, is that there's advantages that we're doing appropriate measures with someone that comes in and complains of a problem. Shoulder hurts, back hurts. What processes so that it stays a small problem. It doesn't become to the point where it's disabling, causes time off work. But that's the whole goal here. And with each employer, the way they address this is going to be different. Determination of whether it's a work injury or non-work injury is going to be important. And that's one of the things early on you have to identify with the employer. How do they handle these? Some employers will treat a work injury and non-work injury as the same. Joe comes in on Monday morning and says, geez, I was playing volleyball and I hurt my shoulder. The employer says, okay, we're just going to treat that. We're going to take care of it. Others, though, will, with that complaint, will treat it differently. Okay, so you have to know where you fit. If we have a provider on site, they need to know that and be on the same page in terms of how the employer wants to handle it. Later on, whether we get to it today or the next one next week, we'll have a fairly lengthy discussion about recordable and non-recordable injuries. And this goes somewhat hand in hand with that, because if it's a work injury versus a non-work injury, has an impact on the recordable side of things. And so it's that communication is very important. And the early intervention may involve multiple of those services. It might involve doing an ergonomic assessment, job coaching that goes along with the ergonomic assessment. You're working with that employer, an employee at their job, coaching them through looking at how they do the job and making a correlation between how they do their job and how does that relate to their complaints. How much modification can you do? What advice can you give them? And again, we'll talk later about the recordable. We have to be aware of what can we provide to them if our goal, if the company's goal is not to make a recordable injury. If they don't care whether it's recordable or not, then it's a whole different issue. So there's nuances there that we'll talk a little bit, hopefully become a little bit more clear later. But there may be treatment involved here. There may be first aid, there may be advice. So multiple things in order to handle this early complaint. And there's a lot of evidence, as we probably all know, is that intervening early, there's a lot of studies that have been done on early intervention related to back problems and how it decreases lost days, decreases the cost of care. And this is just another example of that. So why employers realize that the longer that someone is off work because of an injury, the more difficult it is for them to get back. Study after study has shown that, so they're highly incentivized to keep somebody at work. It only makes sense that the sooner you can address something, the more likely it is for them to stay at work. Okay. So with that little background, I'm just going to hand it off to Larry, and he can kind of go in and I guess discuss a little bit more in depth about real life situations that early intervention would be involved.
Okay. So I'm going to talk a lot probably during this, about what I do at Case New Holland in Burlington and what I do at Hahn and Muscatine. I've spent a lot of times, probably more time with Hahn, but recently in the last probably 6 months with Case New Holland, and really been able to kind of formalize a lot of things. You see a lot more things on a regular basis. So, I'm putting in the knowledge of this, of how do we take what we know and how do we train somebody, just giving that information. So these are the two companies that have really helped me kind of understand how to get my knowledge out there a little bit. So, early intervention, that's really what we want. This and job coaching, it's really what we want to be on site for. We're going to spend majority of our time, whether it's in, physical therapy, you're actually treating them, or you're actually getting somebody in when they have an initial complaint. What are you going to do with them at that point in time? How do you help treat the patient or treat the worker and move them throughout the system and get them going in the right direction? So at Case New Holland, really we've kind of set a pattern of what we want to be able to do. An employee may come in to the health department with a complaint or an injury of some sort, and it's usually reported to the supervisor at that point, or a nurse, and at that point they fill out an incident report. Okay, and that incident report is going to have a combination of where the job is, who the supervisor is, what the workstation is, how it happened, was there any witnesses in there? And so it kind of gives you an initial insight of what happened. And so you can kind of follow with that, okay, and look at that if you want to. The nurse, sometimes will say, if it's just a cut or something, they're going to address that. If there's, the risk or there's a chance that it might be a musculoskeletal injury of some sort, then they may ask you, hey, can you assess this? We're not asking you to, take a whole hour or do a whole evaluation that would take 60 minutes. It's just a 5-10 minute assessment of really what we're doing and seeing what the problem is. And if you deem that it's something musculoskeletal, but you feel like they can still work, you're going to communicate to the nurse. You're not making decisions on whether they're going to work or not. You're just reporting, what your opinion is, what you see. Okay, and you're certainly letting the supervisors know that, and you're letting the nurses know that, and that's their decision to decide whether they can continue working on that or not, or how they're going to direct care with that. if it's something that they just come in and it's a small muscle strain or a bruise of some sort, and they still intend on, they get a little first aid and they still intend on going out and finishing their shift, and they feel that it's appropriate, then it's a good opportunity as you as a therapist on site is just go right out with them on the floor. Go to the workstation, talk to them, do some job coaching, just analyze, okay, what movement patterns potentially aggravate them. And this could go too with somebody that's a non-comp injury that maybe hurt themselves playing volleyball, they got a shoulder problem. Maybe you can coach them up a little bit on saying this movement pattern is, you're not telling them not to do the job, you're not telling them you should clearly not do this job. You're trying to talk about some recommended movement patterns that you might be conscious on avoiding a little bit, and be mindful that these workers will take what you say and they'll say, well, the therapist told me I shouldn't do this. The therapist told me I shouldn't be doing this job because I have this. Some of the workers are going to do that. So you just have to be real diligent on not using what words you choose, reinforcing that I'm not here to tell you you can't do your job. I'm just trying to help you with that.
Just to comment on that when Larry talks about Case Mulholland, in my previous comments regarding the recordable versus non-recordable, is that Case Mulholland's an example where they don't differentiate, they don't care about the recordables. So that makes what we're able to do a lot easier, because as we'll discuss next time, that there are things that we can and cannot do to determine whether it's a recordable. And some employers, for example, Han, as an example, are very aware of the recordables, and they go to extra length to avoid recordables. So you may have the exact same situation, but how we interact and what we can do is going to be dependent, on that. And then the second point, as Larry mentioned, with the whole interaction with employees, goes to the previous conversation of having to be aware of the dynamics of the employee, the supervisor, health, OC health, the nurse, and it's easy to get sucked into a trap of, like Larry said, the employee pitting us against everybody else, and it creates problems for management. So we have to be very well aware and able to manage that whole communication and knowing what we can and should say and being aware of all that. So it can be very tricky. Anyways.
And in later slides, Greg, we'll hit on that a little bit, the terminologies, if you're wondering what those things are. So you can either, so then at that point in time, you're doing what I combine job coaching and education, okay? You're gonna educate on what's the expectation of the injury, okay? They sprained their ankle, it's gonna swell tomorrow, it might turn black and blue, it might be a little bit stiff, giving those expectations that it's manageable, but expect these, ice elevate. So what to do from a first aid standpoint, it's okay to give those, what are the first step, what is the ice going to feel like, because some of these workers have never iced before or never heated anything. So, you might give them a little bit of expectations, and then again, talking about the movement modifications. So you can do that in the health services area, in the nurses area, you can do it in the therapy area, it just depends on, or you can do it out on the work floor. If they're doing a job that you can take extra time and not affect productivity, then supervisors, hey, they're happy for you. They're like to have you out there and talk that for the most part once you get there and you're comfortable. So it's oftentimes like I said, it comes down to where they come in the nurse's station. The nurse says, hey, can you take a quick look at this? I'll assess it a little quick, and then I'll walk right with them, and I'll talk with them as we're walking to the workstation, and then we'll just talk further about that. And that just, and then that really leads into some other things. Once you've done this, you'll talk to the nurse and you'll give them your opinion, or you might talk to the supervisor, about what your kind of general thoughts are, and so they can make those decisions on whether they can stick them in another job or keep them there and just keep an eye on them, or really give them the knowledge. And then again, supervisors are pretty, in my experience with Han and Case Mulholland for sure, they're really open for that information as a therapist. And then at that point in time, we have to determine what is the health interactions. What do we do for, first aid? What are we going to, talk to the nurse? What types of things are you going to implement? Certain first aid things, the normal ice, elevation type of things, whatever that is. You know, we'll talk a little bit about what stretches we can talk to them about, massage and different things that we can do. You might say, I recommend physical therapy. I think this is an injury that might, warrant some physical therapy, through the direct access type of thing. I think if we get ahead of this, at that point in time, it becomes recordable, but it's something that you feel it would be appropriate. And then you just tell the nurse that I think this is appropriate, and they can get the ball rolling if you really think it is. If you feel like, boy, I think there's a fracture here, I think they really should see a doctor, then you start making that recommendation. So this doesn't seem right, there's something there. Again, you're going to tell the nurse, you're going to tell us, or the supervisor, whoever is on site. Some of these places won't have a nurse. So you're going to recommend that. I think this is, again, you're going to go through that part and determine what those health interactions are. And then, as we get on in site, okay, then you're going to help determine what the safety interactions are, okay? So and so I've categorized things in kind of 4 categories. So job coaching, job retraining, job modification, and job restructuring. Okay, so job coaching is really about, you notice one worker is really, not doing things, you got poor habits, work habits, what they're doing is certainly feeding into some of the situations. It's like, that doesn't look anything like anybody else is doing. It's, maybe you got somebody that's what we call those motor morons. Boy, I don't know how they're doing that. So you coach them up and they're like, wow, I didn't know I could do that. Okay, so then maybe that one worker, maybe everybody else is doing things right, but maybe that one worker's, so you coach them up, you try to talk to them. There's job retraining, things that you notice that maybe the whole area, the whole workers, maybe 3 or 4 of the workers are doing the same thing, having some bad habits. And so you might talk to the supervisor about, hey, we need to kind of talk about retraining all these people a little bit, giving them some advice, okay? And those are the things that you're going to do as a therapist, and you're going to consult with, and you're going to be able to say, yes, we can do that, and not get too in depth. The other job modifications, it gets down to, okay, maybe you need a new tool, maybe you need a new design of something. They need to move this job, and you can consult with the supervisors and say, this is, I notice a lot of people having this problem, and it's just not a work habit, it's a design. So you may recommend doing some of those things. And then the job restructuring is just maybe the product is, and you're not engineers, but you'll start to see things as, you'll hear employees saying, well, the product that I'm getting to assemble is too big or too small, or, it just doesn't fit right, and it's not necessarily that workstation. So it gets to your workstation, to their workstation, and then it becomes a problem. So those are things that when you start doing some of these PDAs and job analysis and the risk analysis, you start seeing those. But those are things that from an early intervention, you look at. I can do job coaching, I can do some job retraining, but it looks bigger than that. And I'm going to really have to get to talk to the supervisors that, this is going to be a problem that's aggravating. You really want to avoid saying employee needs this, okay? You don't want to just say they need it. They're going to grab that. So you start saying, this is what I see. This is, and again, those employees won't hesitate to tell supervisors that, hey, they told me I need this, and I can't work unless I have it. And so you just got to be careful with some of that terminology. And then obviously it'll be, again, we'll get a little deeper into, some of these things. Might say, get a nurse and say, what I do at Case New Holland, they say, well, they've been complaining about this job for a long time. We really need you to do a PDA, a job analysis on this, so we can really get that to the safety, and they can really, maybe they think it only requires them to lift 35 pounds, but it's it's actually 50 pounds or something like that. Or there's a lot more force in this pulling this pry bar than it normally is. So they ask you, maybe you should do a PDA job analysis on that job, and then it leads into more of that, okay? And then obviously you're just gonna, okay, so if you have this early intervention, you can follow up with the employee, right? You made that first initial contact, you know, the nice thing about going on site is you don't have a select schedule to see these people, okay? I mean, if you're seeing therapy in the clinic, you have select, or on site for actual therapy, you do, but you can arrange your schedule to move around the plant and spend, 2 minutes here, 2 minutes there, interaction, ask them how they're doing, move around. And every time that you're on site, you do that, and they recognize your face. And so, and they might tell you, okay, hey, it's getting better, it's getting worse, or, and so following up with them on that. So that's the nice thing about there's not a set schedule. You can navigate through the plant a little bit better, okay? With HON, there's a similar component with that, in the sense that we started doing that same component. They have since kind of moved things to where everything, if they have a complaint, they send it to the doctor, and then the doctor or the safety will generate your contact with the employee. And so at that point in time, it's more than likely either going to be a recordable, and you're going to define it's recordable or non-recordable. And safeties might say, hey, someone's got a complaint, can you look at that? Or the doctor's going to say, hey, we need you to do therapy, or we need you to follow up with this person. We need you to do a risk analysis and so forth. Okay, so HON has moved to that model a little bit more than just randomly going through the facility.
Just a couple of comments. In terms of treatment, early intervention, again, the recordable, non-recordable. To not be a recordable, there are things that can be done, which is described as first aid. Any medical treatment would be recordable. First aid, not recordable. So then what that we might be involved in would constitute first aid. It's things you can apply heat and cold. You can do massage. You can use non-rigid type of splints. So for example, in our case, kinesio tape, but you can't immobilize a joint. So it gets to be really fine in terms of what you can do. We'll discuss it later, but it does go into the early intervention. Things that we could not do, you can't manipulate joints, you can't prescribe exercise with terms like designate how much frequency, how many repetitions, because that's considered medical treatment. So, so knowing, again, recordable or not, and knowing what first aid, what are we able to do? There are some things we can do in conjunction with what Larry described. The other thing would be, and this doesn't necessarily go to on-site, but it's really the early intervention. Another model that we might be able to utilize is, and this has happened before, where there's an injury at work or somebody comes in with a complaint with this employer's and they send them to your clinic for an assessment. All right, so yes, it's not on site, but it's early intervention would be another potential model or arrangement we could have with the employer. So, okay. Any comments? Anyone want to elaborate? Throw anything else in there as far as early intervention? And you can also see how the services kind of meld together depending on the individual circumstance. So with that, kind of leading into the next one, the physical domain assessment, essential job analysis, all those different terms that you might hear from an employer. But the common thing is oops, hang on, I've been playing.
We're going to need our technical advisor.
What happened?
Well, I can't close this thing.
This is the man.
Okay.
Went to the mountain.
All right.
That's about the extent of my skills.
Well, it worked.
Yeah,
All right.
Would have been a
So-
brief, presentation if you didn't.
So whatever you want to call it, whatever name, all you're doing is quantifying the physical demands of the job. Looking at a job, so you're looking at identifying what are the essential functions. And the essential has a definite definition to it. It's not everything they do. Essential has means a certain thing. And then you're looking at postures that they're in. You're looking at quantifying the forces, how much push-pull force, how much carrying, how much weight, and where are they lifting it from, where are they pushing it to. You're quantifying the frequencies in which they do it, and you're measuring heights and distances. So there are formats that you fill this out, so it's an identification of what is physically required. So why is this needed? In what circumstances would an employer request this? There are a couple. Oftentimes it relates to you have a employee with a complaint somewhere along the continuum of early to chronic, and you're matching that job, what is required, to what that person can do. So where we fit into this in the clinical side, as we talked about in the Work Comp 101, is we need to be aware and measure, assess what is the person able to do, so that when a PDA or essential job function analysis is done, we know what the job requires, we know what the employee can do, so it's a matter of matching it up. Do they qualify for the full duty job, or is there modification? Do they qualify for some other job? And that's what Larry has been doing, for example, measuring all these at Case New Holland, and they use it for these type of purposes. So oftentimes in our world, it'll be some type of an injury or matching up because they can't do their regular job. So having quantifiable, measurable numbers is very helpful. The other, not in the realm of what we're talking about here, but we talked about before, is that employers will use these for new hires. We talked about the work steps, the post-offer employment test. You have, in order to establish one of those, you have to have information about what the job requires. So that whole process involves doing a PDA or assessing the physical requirements of the job, so that when they go to hire somebody, they're looking for employees or candidates that can do the job. So that would be the main two reasons or general categories of why job analysis are done. So there are forms. Larry will get into that a little bit here and go through some examples of how he's doing these.
So I kind of categorized the forms in three specific things. So over the years, I mean, there's just lots of little forms. You know, I categorized, one kind of in a standard checklist. We have forms that employees, some of the companies that we go to don't have any job descriptions, or they have, they basically have a really vague job description. It really says they have to be able to lift up to 50 pounds, and they don't really describe from where or how often. And they have to be able to bend and squat, but they don't really get into. So we have some things, simple checklists that, forms that we can give to them, or we can fill out ourselves to really kind of get a quick analysis of what that job is. You as therapists in the clinic, sometimes it's helpful to say, when is this guy ready to go back? What does he have to be able to do, right? As therapists, you're all asking, day one that you're evaluating somebody, you're saying, what do you have to be able to do when you go back to work? Or what do you have to be able to do, right? Whether they're post-op or shoulder, you're asking that, what is the functional, your abilities, or what do you have to be able to do? And they should be able to get something from their employer and you get a good outcome, or a good look at that. But some employers don't, okay? They could be small companies, so sometimes we can just simply go and say, hey, let's go look at this job. And that's really kind of how I got started with doing this, is looking at the job, doing one analysis for a small company, and then just really looking at more and more. So this form is just kind of like a checklist, and you plug in numbers in there, and it's, usually maybe 1 page or 2. Okay, it's pretty general, but it's good for companies that just want sort of 1 or 2 people and stuff. There's the medical specific forms. Now, this is what I started doing at Hahn. When I was at Hahn, doing all the stuff, the doctors, Dr. Allen really wanted to know, hey, what does this person have to be able to do? So you give some subjective information, you give some, not yet. So you give some subjective information and some, what does the job have to do? And then, then I indicated, I put some pictures in there, and then I indicate positive aspects of the job and what are some of the risk factors that I see, so it incorporates some of that as well. And then what recommendations. So it's just kind of helps give the doctor some information, helps give the therapist some information, and helps give the employer or the safety department some information. So it was fairly encompassing, but it was something that they felt was beneficial. It's designed, and it's usually just specific to 1 employee. All right, and so that's what, again, I started with Hahn, providing that service. They liked it, okay, and then it eventually led into, okay, let's do something a little bit more that our safety department can do, and so they asked us, myself and Greg, to kind of come on site and teach them. So, which leads into the company developed type of formats, which we really like and we can use. It's replicable, or you can basically use it as well for any other company. Duplicate, sorry. So it's good for the entire company. You can, and that's what Case New Holland is doing now with their form, and what Hahn is doing. So I'm going to go a little bit in on what Hahn, the form looks like, and then what we've been able to do here. Okay. So this is kind of the standard form. This one is conjunction with a risk analysis. So it's a 4-page report. Okay, it's fairly simple. And what happened was, Hahn said, they tried to produce something. So a couple years ago, similar to this, it got out to the supervisors. There was all sorts of information put on it. There was no 2 that were alike. They struggled with getting the information. It was a good idea, but it just was very kind of difficult from that sense to follow. So they asked, based on what I had presented them in this medical specific form, they asked, hey, can we, nice.
You want to use that?
Okay, so basically, once we determined, that we can help, they wanted basically their supervisors and their safety people to be able to see a lot of jobs, right? They were getting so bogged down with 10 forms that take 2 weeks to fill out, and then they weren't really able to address a lot of jobs. It would take 2 weeks to address just 1 job and the risk factors. And so they want to move that timetable up, and they try to get rid of some of the other forms. And so this is kind of what we came up with. And we can duplicate this on any other company, and it's a little quick to go, or quick to use. So the basic components of all these are going to be the same. You have the essential function. You're describing the essential functions of the job in a description of tasks, some of the things that you do on a regular basis or you don't do on a regular basis. And usually what we do is we videotape the job. And I'm not going to get into specifics as how it's doing, but just laying out what the job forms look like, but videotaping the job and then just going through and filling out this form. It has a strength component, which is basically material handling, lifting, pushing, pulling, carrying component, which is all going to be something that you can describe, and there's a lot of drop-down menus and numbers. It has a mobility and posture component, meaning what positions that you have to get into, sustained bending, reaching. The mobility might be considered walking, crawling, climbing, things like that. So those have components of it. And then we kind of have a description part of it that over here that you can kind of elaborate a little bit more. And then we have things with tools, describing how tools. They have a lot of upper extremity problems, okay, shoulders, wrists, elbows, necks, things like that. They all feed into together. They've moved everything up off the floor for the most part, but they're using a lot of tools and assembly jobs. So we focused on, a lot of the tool use is a huge component. So we felt it was necessary to put a big component of the tools and how they're used in there. Okay. So the benefits of this form, it's usually should be able to assess the job and get it reported in 2 hours, if you get good at it. This other area over here, there's areas for pictures that you can kind of describe the job. And it's designed that if you look at this, you can quickly get a reference of what the job is, the job demands. Okay. Move it back to slide.
Go up and click on that.
So that's kind of the job analysis form that we're using for ON. And they have, 12, 15 companies. And we're doing training for their supervisors and their safety personnel to be able to do this as well. And that was one of those services that kind of morphed into what can we provide in that extra training. So it's a service that we never really went into doing, but it's helpful to be able to do. So we'll get into the Case New Holland one.
I didn't know it did that.
Yeah. All right. Well, you're going to be stuck with
Red marks.
red marks. There's probably an eraser somewhere.
Probably.
Yeah. So Case New Holland. The origin of this one was we secured a contract with Case New Holland from somebody that had some of these contracts in Racine, Wisconsin. They helped us with this, and they said this is the form they use, and so this is the form we want you to use. Okay, and it's the nice thing about this, it can be anywhere from 5 pages to 8 pages, but it actually flows pretty good. It's same thing. It has the essential functions of the job over here that you're describing. What are they doing? What are they assembling? Or are they assembling, building, moving, things like that? It has a requirements here, of just some mobility or postural things up here. But then it has, a little bit more diagrams of, lifting, the material handling, lifting, carrying, pushing, and pulling components. That now the nice thing about this is, with the HON forms, there's more calculations. You may have to put some numbers in, and how many repetitions did you do in the course of an hour, and then you can really see that. For here, it really is about coming down to the frequencies and defined by occasional, frequent, and constant. So you're not really having to count the numbers as detailed as the other one, but it is something that you have to keep track of. So you just describe what you're lifting and moving forward with all that. So it pushing and pulling. Okay, next slide. Okay.
Okay.
Bear with us. Over 25 years and over 30 years of experience, we
So we don't know how to do this.
don't know how to do this. So part of the other requirements, then again, it's a list. It kind of spells it out. What do you want to look at? Okay. Is there any twisting involved and how often? Okay. And so, we go through step by step with that. It even has categories where you can just put, is it present? Yes or no? And you can elaborate on it. Is the employee required to talk and communicate with somebody else, or can they do the job without any further communication with anybody else? Are they working by themselves? And then there's some environmental things, conditions that go in with it. So again, the benefits of this one, it helps spell it out. It helps you think through the process. Gives you a little bit more room for describing how things are happening. There's not a lot of numbers that you have to put in and calculate, but it does take just a little bit more time. Now, most of the jobs we can analyze it, out on the floor an hour, and then we can come back and fill this form out in an hour. So in general, most of the jobs take about 2 hours to do between, evaluating time and filling out the form time. So, those are the things that, in terms of the forms that we use, and we're going to kind of use these two forms as a basis of which one we're going to start out using. What can we use to help training, and what best works with the facility. Obviously, Bill in Peoria, Goodfield, and Matt here in Burlington, this is what we're going to use, this form here. I like it. I really like it a lot. And so I think it's, as you start recognizing and start doing components of it, it just helps spell out things that you're looking at. You don't have to always guess what I'm going to look for. It's right there. And so then you just follow this on a regular basis. So that's the positives that. Okay.
Just two comments. One is that you recognize that we've all seen job descriptions from employers. Larry commented briefly that not real helpful because the physical requirements of it, where we're primarily interested, we'll list out, let's be able to walk, stand, bend, breathe, lift up to at least 50 pounds. Well, that's very basic. So this is really looking more specifically and more helpful. And second thing is all these, like Larry said, they're all the same requirements, just formatted differently. It's looking, identifying what the essential function of the job is and attaching physical demands and requirements in order to do that job. That's really all it comes down to. It's like anything else, it just takes practice of what you're looking for. Okay. Let's go on the next one then. Kind of goes into the whole ergonomic risk assessment. So again, different process, although it overlaps somewhat, it can. And this is where oftentimes an employer will say, I want you to come in and do an ergonomic assessment. You have to be careful because it may not be what they really mean. So it goes to that conversation. So defining ergonomics, it's basically just designing the workstation to fit the employee, where they can be at less risk, be productive, but also what you get into is looking at how the employee interacts with the environment. How are they utilizing themselves? What movement patterns? Oftentimes you'll come across where ergonomically things are set up fine. You wouldn't make any changes, but they're just not doing it properly. They're doing unnecessary movements, and that's where like job coaching would come in. So again, they mix. So you're identifying the risk factors that can be associated with a musculoskeletal problem, and you're trying to make recommendations, implement strategies to reduce those risks, whether it's body posture, whether it's frequency, whether it's force, or the parameters that you're looking at. Mostly what we're talking about here is in the manufacturing or industrial. So Larry's comments about Case New Holland, Hahn, Lyondell, those are more industrial. But I think we also have to recognize there's a big opportunity for us, a big need in the office environment. Think of our patients that we have in the clinic. How many are at a computer? You talk to them. Can we go out and do something on site with them? Look at their workstations. And tremendous improvements can be made to help with our treatments. It's very difficult to sit in the clinic and talk to them about set your monitor up here, monitor there. There are some therapists that they have a great business just doing office ergonomics, and that is the same principles apply, different things you're looking at, of course, but yes, we're talking about industrial, but remember most of those industries have office components to it. A lot of people sitting in offices where we can have a great impact also.
Okay. So I'm going to, again, talk a little bit about the risk assessment portion of it as well. Again, Holland, Case New Holland, what have they been doing? What are we doing for other things? Case New Holland is one of those situations is once we do a PDA or job analysis, you're watching the job, you're looking at it, and you automatically really can start to see some risk factors in there. Too much torque on the drills, bad wrist positions, shoulder positions. You just see those things, and you just basically make comments and basically about your observation. That there's no specific form that they use for the risk assessment form. It's just all we want to be able to do is communicate what those risks are. And so it's just a simple form. It's saying this is what I've observed, and you can put recommendations down as well in that form if that's what they're asking. Typically, I spend about an hour of my time on risk assessments and really looking at the jobs and then documenting, making sure I can get that report to the safety or to even HR if that's who wants that. A lot of those things Greg alluded to earlier was you have a job that somebody has restrictions and they want to know if they can match that. So you do the job analysis, you look at the risk assessments, you look at the restrictions, and then you can kind of determine what are those risks as well and comment on that as well. So sometimes those go hand in hand. And then so again, with Case New Holland, there's not a specific form that we use, just load the documents, and I can share that with those that I'm training and doing that. Han has, again, this obviously goes hand in hand. This is the form that we've helped them develop. A lot of the pictures you say have been modified. I believe they're off the Rula, Greg, the rapid upper limb
Or the REBA, rapid entire body assessment. Yeah.
So they're just keys, things to look at that kind of asking when they're assessing, do I see this wrist flexion extension past 45 degrees? Do I see radial ulnar deviation? Things like that. So you're really just looking at the form and then looking at, where's the deviations here? What's happening? At what point of the task are they doing it? And then how often? I find that in training these supervisors and safety managers with this right now, so we're doing multiple sessions, but they're 2 4-hour sessions of training a classroom, and then I'm training them on the floor. They really start to put in these numbers, and they really start to looking for this. I've talked to one supervisor that's been doing it for about a couple months now, or several months now, and he's just he told me the other day that he's starting to look at his young kid and how he's shooting baskets and how he's playing with his toys and his video games, and he's raising things up and the monitors are up because he said he woke up one day and he saw his kid playing, and so they're really starting to see those things more often, and they really like it. And so again, the thing of this form, this risk assessment form, is the more you can see, the more familiar you're going to be with it, and when you start putting it down, you start to recognize. So it's a simple form to fill out. If you can get 80% of 75 to 80% of what the job really says it is, and then that's a win. I mean, you're not going to capture 100%. So this is what Han used. It goes right. They implement this right with the job analysis form. And again, this part of this can be done in hopefully 2 hours together with that. And so that's what they're working on. In terms of other forms that companies like Han have used, they've gotten away from some of these forms because they were filling 10 different forms out like this. They were just, it was cumbersome, and you look at them and some people aren't even filling them out right. I think they're good tools. This is called the REBA, and basically the form is designed to it's just a checklist, and it really gives you a number. And that's what a lot of these supervisors and people want, is are we making changes, and can we make changes today? Can we make changes in a week? And so the idea behind this form, something like this, they have several different forms like this, but is you break it down in between neck, trunk, and leg, and then another with the arm and upper extremities. And basically you look at the posture. Is it happening during the activity? And then you get a number, and it might be a 2, and then you just add them up and you say, is this movement happening? Is there lumbar flexion or trunk flexion or neck postures? Is the leg being bent? And then you come up with a number, and then you add that with the forces. The forces, is it greater than like 22 pounds, and you get a +2. And then what happens, and you do the same thing on this other side. And really what it comes down to is you might come up with a score of a 9. And that score of a 9, it means it's high risk. You need to investigate and implement change right away. Okay, and then so their goal is, I want a number, I got a number, I changed it from, I can document, I changed it from a 9 to a 5 in 1 week. And that's something they can do. And so sometimes you're going to find companies that want to use this. Can you use this for us? This is what we've used in the past. And if that's something they want to do, then it's a simple form. You just learn how to use it and see if you can. But we're trying to get more towards the other 2 forms, where the HON form that the one we use for the other one, HON, and then sometimes just simple documentation of what you're observing and what forms that and what recommendations do you want to be able to promote.
Just go back to for further clarification, REBA, it's not the country singer, it's Rapid Entire Body Assessment is what that stands for. It's a standard form that a lot of places use. Again, it's just a way of clarify or quantifying in terms of where companies might investigate first. And with all of these assessments, it's primarily postural, in that if you look at body positions, so you can look at people doing jobs and you intuitively know right away. If you look at somebody's got their shoulder up here, then you know that's a higher risk than down here. So you intuitively kind of target that area. How do you ergonomically change the job or the way they're doing it, or both, to reduce that shoulder angle? Same thing with all of these. We all know that the further you get away from neutral with any of these positions, the higher the risk. So it's just breaking each movement down, looking at the job. Is there a way to modify ergonomically or from a job performance to reduce the variation from neutral? And it's just a quantification system. So
15 minutes. Coaching, questions.
yeah, I was thinking maybe we end early. So I think this would be probably a good place to stop for today. I would invite any kind of comments or questions, discussions about any of this. If anybody has anything, type it in or unmute yourself and feel free. Nothing? Okay.
I really do think, it's, in the training process of this, it's really, once you can start navigating through the facility, and there might be multiple facilities that you have to navigate through. And the first step is just, if you're already seeing a patient in the clinic and they're out on the floor, go talk to them. You don't have to do a lot of assessment. You just go out there and you just talk to them, watch their job, and see how they're doing things. And And that's the process of the training that it's just gonna give you a step-by-step and ask you to do certain things that first week, not try to overwhelm you with everything, learning all this in the first week. It's just getting you comfortable navigating through the plant, assessing one component of maybe 1 week, one component of the job analysis 1 week, and so forth, and just introducing different things.
So, I think it'd be a good place to stop. And if before we get together again next week, if there's any comments, questions, or anything else that you want us to elaborate on or cover or repeat, shoot Larry or I an email, and I'd be happy to try to include that. But if there's no other comments, then we'll just go ahead and end early, let people get back to do what they got to do, and we will meet again same time next Thursday on the 5th. Okay, thanks.